Good morning, everyone. Welcome to our brown bag session on building relationships with funders. My name is Channing Tate, and I am the co-chair of the Career Development Committee with my co-host Tara Laval, who is on the call. I work at the University of Colorado, Denver in the Colorado Program of Patient-Centered Decisions, which one of our presenters, Dan Matlock, actually leads. So what will happen today is I will introduce our speakers, and then we will open the session up for questions. We'd like you to use the raise hand function to ask questions, and we'll get to your questions as soon as possible. So to start, I would first like to introduce my friend, colleague, and mentor, Dr. Dan Matlock. He is the director of the Program of Patient-Centered Decisions at AHRQ, the Adult and Child Consortium for Outcomes Research and Delivery Science, and is an associate professor of medicine at the University of Colorado School of Medicine. Dr. Matlock is board certified in internal medicine, geriatrics, and palliative care. His research is aimed at fundamentally changing and improving how patients make decisions around invasive cardiovascular technologies. He's been funded under an NIH Career Development Award, 3 NHLBI R01s, 2 as a CoPI, 1 as a PI, and 4 PCORI projects studying shared decision-making among older adults making decisions around invasive technologies. He's participated in the American College of Cardiology's Shared Decision-Making Task Force, and he is an active participant in the International Patient Decision Aid Standards Writing Committee. Recently, he's been named the director of the Implementation Research for Denver Veterans Affairs and Geriatric Research Education and Clinical Center. And Dr. Matlock also serves as a medical advisor to the Governor's Task Force for COVID Response in the state of Colorado. Next, we have Dr. Holly Witteman. She is the Canada Research Chair in Human-Centered Digital Health and Associate Professor in Department of Family and Emergency Medicine at the Université Laval, Quebec City, Canada. I don't speak French very well, so Holly will have to speak the French for me. She also wants us to know that Quebec City is unceded traditional territory of the Huron-Wendat tribe of Indigenous peoples. Dr. Witteman is a scientist in the Primary Care Research Center affiliated with Laval University, the Research Center of the CHU de Quebec Université de Laval, an affiliate investigator at the Ottawa Hospital Research Institute in Ottawa, Canada. With an interdisciplinary background in human factors, engineering, and social sciences, her research is about human-centered digital health, including a focus on how best to adapt technology to people rather than expecting people to adapt to technology. She specializes in human-computer interactions in health education, risk communication, and decision-making, including design methods to support inclusive user and patient-centeredness. Her work as principal investigator has been funded by the Fonds de Recherche du Québec Santé, the Patient-Centered Outcomes Research Institute, better known as PCORI, and the Canada Foundation of Innovation, and the Canadian Institutes of Health Research. So I'm very sorry for massacring all of that French, Holly. So now we will open it up for questions if anybody has a question, and if not, I have one to start. Okay, so my first question for you, for both of you. So Dan, I know you've had a lot of foundation grants from places like the American Heart Association and some local foundations in Colorado. So I'm wondering if you can take a minute to talk about how those foundation grants differ from like a traditional NIH funding and how they may be good or bad for trainees. And Holly, same question for you and how that works in Canada. I'm not sure how even one gets a grant in Canada. So if you could speak to that, that would be great.
Yeah, it's a good question. Maybe I'll even start off with just sort of where I think foundations kind of fit in. Like you have one end of this funding spectrum that's very sort of rigorous scientific review, and I think there's still a lot of humans involved. It's peer review, it's humans evaluating other humans. But then as you step away from that, it becomes, I think, more and more important about the relationships. You know, on this far end is like an individual donor, and the foundations are like a step away from, say, an individual donor, where they have really strong preferences for what they want to fund. And I think some of the challenges there is trying to figure out what that is. Even a big foundation that looks more like a science organization, like the American Heart Association here in the United States, they fund like $100 million of stuff and sometimes team up with PCORI and the NIH. They still have some strong preferences of things they want to see based on their stakeholders and their boards sort of preferences. And it's really important to figure out what those are. I've also had funding here from the Colorado Health Foundation, and they work a little like the American Heart Association, where they're a little more, they try to put some firewalls between the sort of person you contact with and the scientific review. But at the same time, it's still a lot about relationships, because the people in those organizations have a lot more ability to help shepherd your ideas through. So I think approaching a foundation, you know, I remember talking with Dominic Frosch, who's also, at least he was at one time an SMDM member, and then he worked at the Moore Foundation. And I asked him, what's the best way to approach a foundation? He's like, well, you don't want those people who just come up with a phone call and don't have an idea of what they want to do. Those are frustrating. And then you don't want people sending a full grant and without having a conversation with you. So he kind of recommended, you know, a little one-page white paper. Here's my idea. Put the ideas down, a little bit like an Ames, but maybe a little more flexible. Then you send it to the foundation and say, hey, is this the kind of thing you're interested in funding? Could I have a conversation with you about this and see? And I think those kinds of things are really valuable. And Channing, I think some of the stuff you and I work on might really fit nicely for the Hartford Foundation someday. And it might be nice to do something like that, you know, where we write a little one-pager on some of your hospice decision-making stuff, or especially in underrepresented minorities. And we go to the Hartford Foundation and say, hey, is this the kind of thing you're interested in? Can we chat about this? What kinds of things has your board been talking about? And then have a conversation. And I think that's how foundations differ a little bit, is as you move away from these government funded things, the relationships, I think, become more and more important. You still always have to have good science all the way through, but I think the importance of those relationships increases as you go. I don't know if that answers your question.
It does. I think the important thing that you said is that you got to build relationships. And I think, especially as a trainee, it's hard to convey to people that we're serious researchers and that we have some legitimacy if we just, you know, send a one-page email saying, look at this great idea. So.
Yeah, that's hard. You know, I was lucky. One of my first grants was from a foundation, but one of their missions was to train like junior geriatrician researchers at the time. That was the Hartford Foundation. This was like 2007 or 2008. And it was right at the end when they had done a big push for 15 years of funding the next research workforce. And so I knew that was their sort of interest. And then my mentor, Gene Kuttner, kind of connected me with them, and I applied for that. So you can get an idea of what kind of things some of these foundations want to fund from their website. But then even short of that is, if you're in the ballpark, I think that 1 hour conversation could be worth a lot to really push that idea. And I think that 1 hour conversation with a one-page sort of white paper summary, I think you put those two things together, then you could really kind of get an idea. And the other thing is, a lot of these foundations are in cahoots with each other. And so they may say, you know, this isn't right for me at the Moore Foundation, but I know such and such at the Templeton Foundation. Maybe you should talk to them. He was telling me something about interest in this area. And so, you know, I think it's work. It's all work. It's a different kind of work than sitting and writing a grant. It's hustling a little bit. It's like a mix of hustling and grant writing. And then once you find a receptor site, then you got to sit down and write a proposal. But there's a little bit of a hustling aspect to it.
Cool. Holly?
Sure. I think I will say, a couple of points about this is that the US is it's a special place in terms of how research funding is organized. And, you know, we don't have as many foundations the culture of philanthropy is different in Canada. I personally do not have any foundation funding as PI. I've been co-I on colleagues grants in the US from foundations. I think going through someone who knows them is always a good approach, right? So, you know, I don't tend to call people out of the blue, right? I don't cold call. If I wanted to approach a foundation, I would find someone I knew, possibly through SMDM, who has received funding from them in the past, and reach out to that person first and sort of find out a little bit more from them. I will also add that I think it's very different if you are approaching, you know, Channing, you brought up what it's like approaching as a trainee. I would say there's also a distinction between approaching as a clinician scientist and as a non-clinician scientist. I think that's a very different thing, and clinicians have more social capital that they can bring into that conversation with a foundation, you know, which I think is a great advantage for those of you who have a clinical background.
So Holly, is there something analogous to the NIH in Canada?
Yes, it's called the Canadian Institutes of Health Research. Very sort of a similar structure, a lot less money. The whole structure is different in Canada. We don't fund investigator salaries, right? So the direct cost, like the grant amounts tend to be a lot less because you're not paying for the investigators, which is often the big money item on a lot of US grants. You fund everyone else's salaries, so you know, research associates and trainees and so on. But the people, the investigators who work on the grant are not allowed to be funded by grant funds.
Yeah, I think that comment about clinicians, if I could just piggyback on that, is a good one. I think clinician, there is like a social capital, but you can come in with this. It's not fair. I'm going to put that, but it is a thing where you, oh yeah, I'm a doctor doing this research, and you get a conversation, and you also have a lot of stories that are very personal that you can share. And stories go a long way when you're building relationships. We all know narratives are a powerful way to sell ideas generally. So I think that's helpful. But honestly, one of my favorite things about SMDM, and I will admit I have not been a good SMDMer this year just with the schedule, but I love this meeting. And that part of the reason I love it is because it's like half clinicians, half PhDs, and you sort of debate good theoretical science with practical, clinically grounded questions, and it's fun, and I've grown more. And so I think that can be also a selling point, is that you're a clinician working with these scientists and bringing these two things together to answer this really important question. I mean, I do think regardless of what funding organization you go to, everybody's sort of on board with this team science idea now. It seems to be more and more that's just, even I was talking to the NIH the other day, and I was talking about co-PIing versus PIing a big application. And they said, oh yeah, 20 years ago, you should only have one PI. But now I think most panels really like to see co-PIs. I think everybody's on board with the team science aspect. You know,
for junior people, especially.
Oh, go ahead, Holly.
Oh, sorry, go ahead. I was just saying, especially for junior people, which I think is actually a little unfair, because I think there are lots of junior people who could PI a grant perfectly well, but I've seen it happen. It is often, a lot of people will put a more senior co-PI on their grant, and it does help. It helps the grant get through. Even if that person isn't really all that involved, and you talk to them like once every 6 months, but their name is on there, and so the reviewers are like, oh, it's okay, so-and-so is co-PI. I don't like it, but that's the reality. I've seen it over and over.
Helps reviewers feel more comfortable. I mean, even at your most scientific, and I bet Canada's the same. I always tell mentees, like, your audience when you write that grant is not like some public scientific expert. It's like 3 people who are sitting in their room at nighttime volunteering. I'm usually drinking a beer when I review grant. You know, like, that it's like late at night. Like that's your audience. And so white space in your grant, stories, colloquial language, you know, not because you're going to know more about whatever idea it is than I do. And so if you make it really hard, it's hard. And so even at the most scientific review, it's still humans evaluating humans. And if you can kind of tug at some of those heartstrings, you still have to have good science, but I bet you most people can do that. But you got to also tug at those heartstrings and get those significant scores and innovation scores up, which are sort of the heart scores.
Yep.
You know, they're not the brain scores, they're the heart scores.
Well,
And
you want the reviewers to love your grant.
yeah.
You want them to fall in love with your grant, and people fall in love with grants that are compelling and that are easy to read. And, and Dan keeps saying, and of course you need good science. I mean, like you can't have big methodological flaws, but it's such a tight funding environment right now that what wins it is, compelling and understandable. Everyone on my team knows, like, every time someone puts an acronym in something, I'm like, no acronyms. You've just slowed down your reviewer. And even if your reviewer is not aware of this, your reviewer is now a little bit annoyed, a little bit tired.
And if they're Dan,
pardon me?
and if your reviewer is Dan, they're drunk.
Yeah.
Yeah, no, I think grant reviews are as much about the human aspect as the science. And I think that's where, the funding question, I think that's where I see a lot of people who are juniors sort of fall down a little bit, is not that they're not great scientists, but they don't do enough sales.
Yeah.
Like I love writing grants because I think the sales is fun. And then I struggle when I write papers because I want to keep that sales writing. Like I want to write a discussion and just tell everybody why I think this is important. And I've been dinged by reviewers for papers who said, oh, you're just a little too opinionated in your discussion. Like, yeah, you're right. I was, because I like doing that. But in a grant, you can sell a little bit. And you got to. I mean, it is sales. And so that's where you're selling to the NIH. You don't get to have a relationship with the person reviewing like a foundation. But you're still sales. I think that's where it's hard.
Yeah, I love it too. It's my best skill. It's grant writing. Well, and you haven't had any problems yet. When you write the paper, you've had all the problems. I don't have a problem being critical in my discussion, but I'm like, and here's my list of 47 limitations.
All the things I wish I had done differently.
Things that we learned that we won't do this way next time.
Yeah.
Whereas when you're writing a grant, everything is open before you.
Yeah, everything's gonna be perfect and great.
Do we have any questions yet?
I think Tara has a question.
Oh.
I have a quick question. Actually, I have two questions, but I'll start with one that follows up from what you guys were just talking about. Do you have any advice for people that do not have great grant writing mentorship at their institution? So like all the things you're saying, leave white space, tell a story, put it in with the science. I think these are all really good tips, but people learn a lot from mentors. And I learned a lot from mentors in writing my papers, but do you have any tips for people that don't have really strong mentorship at their institution in writing grants in particular, any grants, but I think any grants can be particularly challenging for me.
Just beg other people.
From other institutions?
Yeah, I do this all the time. And I've done this, and I had this, so one of my a big source of my funding was a program grant. And I almost got it. I was one of 9 people who made it all the way to the end and didn't make it past that final totally multidisciplinary panel. And I'm like, something about this grant is getting stuck at that panel. And so I reached out to a cell biologist who I know from Twitter, and I was like, can you read this and just tell me what is bugging you about this? So I just blatantly beg people, can I have half an hour of your time to give it a quick read, pretend you're reviewing it, and like be as critical as you can and highlight all the things that aren't working for you. I think of it like I'm user testing my grants.
Yeah. All right. That's good tips. I guess I like sometimes feel like I'm really imposing on people outside the institution because these are a lot of work.
Well, you can't go back to the same people over and over again, right? So you have to know what an ask, like when to ask and that sort of thing. And you have to be really open and be like, I understand if you don't have to, you have to give them enough time. Like all the usual niceties.
Yeah, that makes sense.
But that's part of people's job.
Yeah,
and most people are actually kind of like, that's an easy ask. You send me some, please don't do it because I'm so overwhelmed right now.
Well, that's kind of what I think of too. It's like,
right now is a weird time, right? Right now, everything's a little bit different, but in normal times, right? If someone sends me something, it was like, would you spend half an hour, do a quick skim through this and flag anything that sort of pops out at you as problematic? I'm like, oh, that's really cool. I love that. 30 minutes, limited time, boom, there you go.
Yeah. All right. That's helpful.
Yeah, I think the way Holly just said it is nice. And I've had a couple of those like, hey, can you just take 15 minutes and give me 30,000 foot comments? I don't want you to wordsmith or read the whole thing. And that does feel easier than trying to read the whole thing. And also, a lot of people, there are some institutions where there's a culture of not sharing grants. At the University of Colorado where I work, in a lot of places, we share grants all the time. I'm happy to share grants with people that have been successful. Channing's written a couple of the more beautiful grants that I have seen, and I just find people who are willing to let you look at it. And I usually say, hey, go ahead and please look at this. Don't send it around without letting me know who you're sending it to, because I kind of like to know where it goes, and who's looking at it. But, I think looking at other successful grants and just getting an idea of the format, because when you look at those, you kind of see, oh, these are really easily written. There is white space. There's nice headers. I try to get it where you can.
No acronyms.
Yeah, very few acronyms. Where I write
zero acronyms. Zero.
I can't get quite there.
I ding you as a reviewer, just so you know.
But I try to get it where when I write my background, the topic sentence of each paragraph is all you have to read to get the gist. And then you can get the details and the references, but I write just the topic sentences for the flow. And then if that all makes sense, then I go in and add all the supporting data, but I bold that topic sentence. So you could read my whole background just reading the first sentence.
We have the exact same style. Exactly.
Yes, we must have had some of the same teachers, because you just want to make it as easy as possible. When I reviewed for the NIH, I had to review 8 grants, and I did one a night for 8 nights, and it took me 2.5 to 3 hours each night. And it was fun, and I learned a lot. And I learned a lot about what to do.
It takes me about 5 hours to review a grant.
I give up.
And my piles are always like 8 to 12. It's brutal.
That is brutal.
So speaking of reviewing grants, we actually have a question about that. Aubrey, do you want to ask, or do you want me to read it for you?
I think we can all see it. We can just go ahead and answer it.
You unmuted, so let her ask.
Feel free to read it if you guys like. It's great to see everyone.
Hey,
As always, great insights from both of you. You know how much I admire your work and love working with both of you. I know both of you have served as reviewers. I'm wondering if in just a few minutes, if you could share some of the big lessons, perhaps unexpected lessons that you've learned in reviewing. And especially I have a mind and a heart for our trainees. So if there's any advice for how trainees and junior faculty can get involved as reviewers, that can be incredibly helpful.
So here in Canada, junior faculty are strongly encouraged to apply for the CIHR Observer Program. So you get to attend a panel one time. I was part of the group that helped set this up, so I'm really proud of it, and I'm really happy when people have a good experience with it, and most people have a pretty good experience. The one thing is you're not allowed to talk. So, and that was not a recommendation, but that's what they decided to do. So you function much like a reviewer. You get the grants ahead of time, you get to read them ahead of time, you show up, but you're not asked to comment on them, which I think is an oversight. They should ask people. But in any case, that is a really good, it's a lottery-based program. It's all funded. So, you know, you put your name in the hat for the panel you want to observe. And usually most people get to go eventually. So those kinds of opportunities, tell people you want to review. Do you know how many places are looking for reviewers?
Yeah, that's a really cool program. That would have been awesome here. You know, my first grant review experience is there's always some little local grants, like the department's going to fund two little $10,000 grants, you know, and they need reviewers, and I'll push people to sign up for those just for the experience of doing them. They're often struggling to find people. And even short of grants, just getting in some of these review panels and seeing, you know, Channing and I are both involved in this palliative care research days, and we're always struggling to find abstract reviewers. But usually just even getting people to get around and review some of those things so you can see the process and see how sort of whimsical these panels are. Even among people that you know and respect, you can be very sort of whimsical, and you can't always predict what people are going to come up with and what they're going to say. But I think the question, Aubrey, is great. And if you can look around at your local institution, find some little grant panel. Hey, I see this small grant, and then just raise your hand. Any chance I could be a reviewer for this? I honestly think grant writing is, to get to Tara's question earlier, it's a skill, not a talent. And you can learn it. And I think going and reviewing some of these things is a good way to learn. And I bet if you raised your hands 50% of the time to be like, oh, great, somebody wants to review grants? I can't believe it. Okay, you're in.
Be careful how far you raise your hand.
Yeah, you got like that could explode in your face. But I think that if you haven't done it, getting on one of the, I wish there was something in the United States where you could go review an NIH panel or just kind of observe, audit an NIH panel.
So they have a video of it, right? I saw it when I was a postdoc. My mentors sent me to a grant writing workshop, and it's old, it's like from the early 2000s. But I watched that. I'm like, yeah, that's what grant panels are like. They're still like that. There's just less. It's just that the success rates are lower. Right?
Yeah,
but
I haven't.
But yeah, and I would.
Go ahead.
Oh, I was going to say, I would encourage people, tell mentors, tell other people, say, hey, I'm looking to learn more about grant review. If you hear of any opportunities, let me know, because, you know, you're not necessarily going to know about them otherwise.
One thing.
I will totally pass your name along. If you tell me you want to review things, I'll be like, next time I get a request, I'll be like, no, but would you like to speak to so-and-so?
One thing, as I know Tara has a comment, but one thing that's really helped me as a trainee is also reviewing some papers for journal articles with Dan. I've learned so much reviewing other people's work. It's been, so if you're not ready for a grant, maybe try a paper. Tara?
Yeah, there's the mock study section, yes. I would say,
Oh, nice.
I would say the other thing that I have learned serving as a reviewer is that the number one thing that kills people is lack of clarity, right? And I've seen it happen where people get a review back. Sometimes it's for a manuscript, sometimes it's for a grant, and the reviewer is like, there's no information about X, Y, Z, and the person gets really offended, and they're like, that's on page 7. I'm like, yeah, but your reviewer probably wanted that information on page 2. Right? Like most reviewers don't read the whole thing through and then go back and read it again and make comments. You get one read and they make comments as they go, and then they submit their review. That's how most people do it. And so if you get that kind of comment, like it wasn't clear about blah, 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 you can sort of construct from the comments where they were in your application at that point and be like, oh, I need to move that information further up because they need to know that before they get to blah, further down. And so really taking it seriously, how you construct the grant and how the human who is reading it is going to want the information. Sorry, that's the human factors engineer. When I say it really is, when I send it out, I'm literally user testing my grant.
Terry, you were going to say something earlier.
Yeah,
Oh, sorry, Tara.
say that there is an early career reviewer program in the US with the NIH that sounds like what you're talking about, Holly, in Canada. I'll just say that I signed up for it a long time ago and I never got called for anything. So I'm not sure if it's, you know, very limited slots, but I'll put the link in the chat so people can look into it. And it's probably useful to sign up anyways, and maybe you would be lucky and get.
It might be the kind of thing where you have to sign up each time. That's how it works here. It's not like you don't just sign up one time and they hold your name forever. Every year, every cycle, you have to put your name in.
That might be true. Maybe I'll just keep signing up.
You know, another thing that and I'm curious how this works in Canada, Holly, but another way, back to relationship building, one thing I see junior people do is kind of wait for a long time before they'll talk to the project officer of the grant they're thinking about. At the NIH, all instances, there are lots of project officers. And it kind of feels scary and intimidating to go talk to them. But I think once you have an Ames page that you feel semi-comfortable with, even if you're still iterating it, having a conversation with somebody who works at the NIH is going to be helpful, because their job is to get you to write applications and send them in and do a good job doing it. Like, that's what they want to do. So they want you to be successful. So, you know, and I think I was really late on when I wrote my K award 10 years ago, talking to the project officer, and I wished if I had talked to them earlier, I think I would have gotten a little more clarity a lot earlier. That would have saved me some angst that last couple of weeks of writing when I was like fixing things. This is one of the first big grants I'd written. But I think lowering your threshold of when you talk to that project officer is probably a good thing to do, at least in the United States and the NIH. And I have no idea how that works in other countries, but I imagine there's
Totally different.
Okay.
So you don't call them here. And because I trained in the US and I went to a grant writing workshop in the US, I was a new faculty member here in Canada. And I'm like, I'm remembering the grant writing workshop, and step one, call the is it project or program? I thought it was program officer. But anyway,
Yeah,
call the PO.
program officer.
Call the PO. Step one, call the PO. And so I did that. I picked up the phone and I called someone at the Canadian Institutes of Health Research, and they said, "How did you get this number?" Because you don't do that here. It's not a thing. And it's explicitly discouraged, and they do not have officers with the same scientific background the way you do in the US. So it's just and when Tara and Channing contacted me about this panel about, you know, building relationships with funders, that was the big thing. I'm like, this is a huge difference between the two places. Now, there might be other places where, like you were talking about earlier, Dan, the idea of having your one pager, like your Ames page, or sort of a less structured one pager of this is what I want to do. I think that's a really valuable exercise to be able to shop that around. But certainly at the big granting agencies here, that's not how it works.
Yeah, that's interesting. That definitely is how it is in the US, but I could see that being something that varies widely. I mean, the US, the NIH, a lot of the program officers, you're right, are usually PhD or MD level people and have done some research, and so are kind of in a position to give you some feedback on that idea and where does it fit. In fact, I've never talked to one that isn't a PhD or MD. I don't know if that's a requirement for the job.
I believe it is.
Yeah, it must be. But they have a very solid firewall between the program office and the scientific review office at the NIH. So that program officer can't really help you in the grant review. So you can talk to the scientific review officer for the panel and say, hey, does this fit the panel that you sort of manage? But I found those conversations to be a lot less helpful because they're very cagey. They're very sort of, you know, very politically, they're very careful not to say, oh yeah, our panel would love this or our panel would hate this, but rather this seems to fit the kinds of things our panel funds. That's about as far as I've seen those conversations go. Whereas the program officer sort of helps you strategize. Well, maybe you should target this mechanism to this panel, or, you know, this isn't right for the National Heart, Lung, and Blood Institute, but I see you're enrolling everybody over 75. Maybe you should talk to the National Institute on Aging. And they just kind of help you navigate your idea through those things. And I think that conversation early in the United States is important. But yeah, I can see how that varies. Apparently that's not important in Canada.
It's not that it's not important. They don't have anyone to do it.
Yeah.
There's no one in that role. Right?
So then in Canada, is it more just getting a really good idea of what they want to fund from the funding announcements?
Yeah, so you will often, the really good, if you're submitting to the open competitions, one of the best things to do is to talk to someone who has served on that panel.
Yeah, there you go.
Right, and that's public information. So they don't post it until another cycle has passed, so that people aren't harassed by people being like, "Why didn't you fund my grant?" But you can look up what panels exist, and you can see if you know anyone who has served on that panel, or if you know someone who knows someone.
Yeah. So if this was like a focus group with a qualitative theme, like that emergent theme is really trying to get in their heads of what they want, and whether that's through a relationship or through trying to talk to the reviewers or talking to the program officer, it's really trying to understand what they want. And I push a lot of mentees to really do your ideas to your passions, because research is hard. Writing papers and grants kind of sucks unless you really love what you're doing. And so
Even if.
Yeah, and then even then it can still kind of suck, especially when we're all sort of stressed out. But I think, but then you may just have to morph your idea a little bit to fit that particular funder. So getting in their heads, getting in the reviewers' heads, and that's where the foundations is not dissimilar. It's really all just this process of trying to figure out what they're willing and want to fund. It's a little more formal with the government agencies, but even Holly said, you talk to someone who served on that panel because you're trying to get intel. You're trying to get intel on what's going on these days. What do they want? I do a lot of work in implementation science, and the United States is changing their implementation science panels. So we've been talking with Russ Glasgow and our implementation science team, trying to get intel. Well, what are these new panels going to want? And what kind of grants should pragmatic trials go to this grant? And then community-based implementation interventions go to this panel? Or we're trying to figure that out. We don't really know yet how that's going to land. But we're in the process of trying to get that intel. And if you're junior, right, in early career world, you still want intel. If you're going to spend hours and hours of your life writing a grant, then spending 3 or 4 more hours to make sure that grant lands at the right space is just so worth your time.
Well, it just cuts down on the cycles you have to go through, right? Because you get that information the painful way if you submit it without any background.
Which I've done.
Me too. Oh, me too. But I would say, I was thinking about this before this, and I've said this before, I have never gotten a big grant that I hadn't spent that I didn't have a really good first draft, like 6 to 8 weeks ahead of time. The only exception to that is when it's a really short call and everyone has very little time, right? I've gotten stuff like that. But in any other situation in which there is time to plan, if I haven't, really spent the time to have a draft that I can send around and get feedback on and like talk to people and so on, if I don't do that, I do not get funded.
I want to just thank Dan for your comment about the program officers. So we had another panel with Karen Lee, who actually is a program officer, and she really hammered home on the point of how important it is to reach out to the program officer early and often. So if you're in the audience, all these sessions are recorded, so I encourage you to go back and listen to that session. But I have another question, and both Holly and Dan are phenomenal at engaging patients and community members in their research. Holly was the co-chair of our meeting in Montreal a few years ago, and the patient presence there was amazing. Dan and I actually have a patient advisory committee that we run research past, and other investigators can run research past here in Denver. So I'm wondering if each of you can speak to building relationships with patients and community members and integrating them into your grant projects, and how that's worked out for you. Because it seems like it's becoming more and more of a trend to get patient and community engagement in our grant writing?
So I'll go, that's just always been how I've done research. And I mean, it's partly a disciplinary thing, human factors engineering. That's what my PhD was in. You have to involve users because if not, you design bad things. But I would also say, you know, I personally live with a major chronic autoimmune condition. And so it's just always been the way I think too. That is, so where Dan has social capital as a clinician, I have social capital in patient communities because I live with a major disease. And so there are things that I understand that, you know, like I didn't have to learn those. I already knew those from the School of Hard Knocks. So I don't know. I mean, it's a human thing. It's just about relating to other humans as humans and being human with them and giving everyone permission to be human with you. I think the big barrier, I would say, if I were junior right now, like if I were more junior, would be that certainly in Canada, and I think in the US too, there is an expectation that you will offer compensation for people's time. And so if you don't have any funding at all, where is that going to come from? So ask colleagues, ask mentors, ask around. Sometimes there are panels that you can sort of piggyback on, like advisory panels is what I mean, not review panels.
Yeah, I think that it's interesting you mentioned the human factors engineering, that you just kind of start that way, because I've kind of evolved to that over the last 10 years. And PCORI has pushed us in the United States. PCORI's really pushed us because they've mandated it. At least even if it's not patients, just patients and other stakeholders. Like sometimes there are other stakeholders like the healthcare system. You can also fail by not involving those stakeholders. So yeah, we have our patient panel that we've built a long-standing relationship to and that is really helpful. And we've even given them a little bit of research training just so they understand some of the terms that people bring, like specific aim, hypothesis, different kinds. And we gave even a little talk to them on different kinds of funding agencies, just so that when investigators come, and we just meet every other month, and we present 2 ideas. That was, of course, sort of a process they designed. Back before COVID, we would lunch and have a little bit of social time, and then we'd spend about 45 minutes on each of 2 projects getting some feedback, and it's just gold. It's just absolutely gold. And then when I have a more focused project like funding from PCORI, then we build a patient or stakeholder panel that's really involved with that particular illness. Our sort of generic panel is we bill as a panel of older adults with chronic illness. And so they can advise on lots of things. That is the type of work we do. But then if we do something on decision making for left ventricular assist devices for heart failure, we get a much more specific panel that has a lot of experience in that. And then they become part of our team. Some of them become part of our team, some of them, depending on their desires, of their level of desire for involvement, whether it's a monthly meeting, coming to all the team meetings. I've found that it's harder, like when we're in the middle of a trial, a randomized trial, and we're just collecting data for a year and a half, that there hasn't been as much of a role for some of those other stakeholder advisors than there is at the beginning in the design phase, and at the end when you're reviewing the results and trying to figure out how to disseminate them. In the middle phase, we've, at least on a couple of the trials I've run, we've just kind of it's the dog days of data collection, where we're just kind of like trying to get sites to do their follow-ups and things like that, and it's not as interesting for anybody. But we just kind of keep that open with who's ever involved from that perspective. But I think it's really hard as a junior person to involve people in this way. That's partly why the panel we have that Channing and I run, we kind of keep it open to anybody who wants to come and chat with them. And our panel likes that. And their only request is, we want to hear follow-up. We want to hear, did you get the grant? We want to hear, how did we change your science? Like they're very happy to give feedback to somebody with a new idea. Their preference is, I don't like giving feedback if I don't get to hear what happened. And so we make people come back when possible, or at least write up something if our schedule tends to fill up these days. So even if we can't schedule them again, we have them write something so that our panel can get feedback. And that's generally very helpful for everybody. So
That's a huge thing that you hear over and over again when it comes to involving patient partners is don't do helicopter stuff where you come in, you take what you want, you leave, and they never hear from you again. You know, like you can do that once, but you're not going to do it again. And you're going to you can't go back to those people. And if that happens to them often enough, you're going to ruin it for everyone. So maintaining the relationship is really important.
I know Dan has also written some journal articles with patients.
Yep.
He's engaged them in that process of the science. So we have another question from Aubrey in the chat that I'll read. How do we encourage trainees to build careers in patient-engaged research? If anyone knows a patient caregiver partner funding resources, please share using the SMDM tweet.
So this is what I was talking about, though. What Dan is talking about when I said piggyback on existing panels. So Dan has one. I actually run one, and it's specific to diabetes. So I co-lead patient engagement for a national network, and we have the same thing. So we have 3 circles. We have a collective patient circle, which is a variety of people who live with diabetes, who care for someone with diabetes in some way. And then we have an Indigenous patient circle and a Francophone and immigrant patient circle. And so we will direct people, and those circles meet regularly. And we do the same thing where we all sorts of investigators will come. We have people who work in everything from beta cell islet transplants to people who are designing new digital applications, But same thing, we're really open, and we're really happy to have people come and present their research and get feedback, as long as we hear back from them. Same thing as Dan. I think it's universal. No, it's such a universal thing to ghost your people who spent time giving you feedback. It's mean. And sometimes people just get busy, but don't do it. Please don't do it.
Holly, based on the wonderful experience collaborating with you, we created a registry of people who were willing to be contacted about research.
That's awesome.
And we do a quarterly newsletter for exactly that reason.
Yeah.
But I still struggle with the fact that so many times both institutional culture as well as grant culture denies funding for reimbursing their time unless they are considered participants in the research as opposed to an advisory panel member or a research collaborator. And I know we've talked about this before, but if there are resources within our SMDM community, this would be a great time to share those, particularly for junior faculty.
That's a really good point. We talked about this at one point. I remember we talked about this in the patient engagement strategy for SMDM. And the thing that I was the idea that I was really pushing was that SMDM would have a panel. And it hasn't been picked up yet. But if other people think that's a good idea, tell the board.
I'm in. I have no clout or power, but I'm in.
Well, no, I think it was more, I don't know. Anyway, people are busy, and, things happen or don't happen for a variety of reasons. But I do think, I think there's a need for this. I think there's value in this, sort of like a free resource.
I think that's right. I think there's even a little history of this with SMDM, because Holly, I think, was it 2 years ago you were chair? Was 2 years ago Montreal? Yep. And then you had a lot of patient involvement there. And I was one of the chairs last year.
Yep.
And we had some patient involvement, but we also got, I think the board really wanted to kind of make sure and know how what their policies were that were long-term and sustainable. Yeah. I think that's the bottom line of I think there's a desire to do it. It's just, there is an importance of paying, and if we didn't get the PCORI grant, how are they going to pay these patients that we've engaged in writing the PCORI grant? Because SMDM is not the American Heart Association, and we're not the wealthiest society. And so I think some of that was like, what is our sustainability plan for some of those things? And so I think I don't know where they're at with that now. Obviously, COVID blew up whatever happened was going to happen this year.
Come to the business meeting at 3 o'clock today. And then you can see the audited financials. Wait, 4 o'clock, whatever time it is. It's the end of the day. Seriously, it's not. It sounds boring, but it's a really interesting. If you're interested in the society, come.
It is interesting. It can be really interesting, and it's a little bit not. We don't have a lot of dirty laundry, but it is sort of like they put things out there and show it.
Yeah, you get to see the whole budget.
Yeah. And so, but it would be a good service if we had something like that at SNDM.
Right.
It would be good. I mean, and also I think I've come to realize different kinds of science need different levels of patient involvement. Like if you're a data person doing a model, and maybe the amount of patient involvement you need is minimal to help you shape the question and help you make sure the results are meaningful. Whereas some of the stuff we do in implementing decision tools, we need a lot of patient and other stakeholders involved to make sure we do that correctly. And I think PCORI's come to that too, that different sciences need different levels of stakeholder engagement. And PCORI's modified their language over the last 10 years around that. They still really push it, but in 2011, it was patients, and they've softened that to stakeholders, that patients, if that's really important, we've still prioritized them, but sometimes other stakeholders, like if you're developing a clinical decision support model, then your stakeholders are the system, the informatics people, you need different stakeholders. But it's still about stakeholders. It's not, you're designing for users, as Holly said. And and getting those users involved is really important.
Can I just say one quick thing is, from my experience with working with patient groups, they really want to learn, and this idea of capacity building. And so I think we need to think about not just throwing them into our grants, but really like engaging them early. We know people listen to the panel we had earlier on patient perspectives and value assessment. One of the things our patient participant says is, they want an equal seat at the table. So to do that, you need to build the capacity for them to do that. And this kind of off the topic, but that's probably something SMDM can really help with, and sort of engaging and helping with that capacity building at some point.
I know the journal was looking at that specifically. There was a grant that went in, and I don't know if they ended up getting it, but they were looking at getting people involved in grant review. Can I say, because we're almost at time, I was really nervous that there would be questions about getting trainee funding. So like PhD awards and postdoc awards and so on. I was very nervous about that because I never got any. I did apply, but I was not successful at individual level. Like I don't know if they do that in the US, but in Canada, and I think it's just a real, and pardon my language, but it's a real crapshoot, because there are a lot of good people who put in applications and they only have funding for a teeny proportion.
Channing did get one, so you can all direct your questions at her if you have any.
Yes, I wrote a grant called an R36, which was specific for dissertation funding. So if any of you are looking for dissertation funding and want some help and advice, hit me up later. It's been a really good experience to write the grant, to go through that whole grantsmanship process from submitting to scientific review to panel review, and then you get all this money. So last, go ahead, Dan.
Oh no, go ahead. I go ahead, Jenny.
I was just going to say, in our last few minutes, if you both could reflect on any tips that you might have for us to build solid relationships with funders or collaborators, because I work for Dan, so I know that he's got some long-standing relationships that have moved forward the science that he's interested in. So any tips that you have for helping trainees build and develop those relationships with collaborators, funders, or anything else, any other final thoughts that you might have? I made Dan.
Dan looks like he's thinking, so I'll give my two tips. One is keep notes, right? I mean, unless you have a super powered brain and you never forget a name or a face or anything like that. But I literally, like after meetings and stuff like that, when I have a new email, I put their name, I put where I met them, what we talked about, and even just writing it down helps me remember it. So I don't actually need to go to that file very often, but every so often I do have to go to that file and be like, wait, where do I know this person from? So that's one thing. And the other thing is to be human. right? And just be really authentic in your relationships, because it's exhausting otherwise. It's already tiring enough to maintain relationships as an authentic person, but if you try to pretend to be someone or something that you're not, it's that much worse. And I think people respond to that. People respond to honesty.
Yeah,
in good ways, mostly, assuming you're a good person. If you're a bad person, don't be yourself.
I was going to say something very similar, honestly, to that second point, because I think I gave a lot of the tips, but I think just taking that deep breath and being genuinely interested in whoever you're talking to, whether it's a patient stakeholder or a foundation funding officer or the NIH, like just, drop your agenda a little bit and just be genuinely interesting to hear from them what their perspective is and be as open to it as possible. And then your ideas might come on how your idea might fit their priority. Because it may just be a framing thing, or it may be a new direction thing. But I think that genuine interest, then that actually builds a relationship too.
Yeah.
Because that's the human piece of it.
Good point.
So I was trying to think what's different than what I already said, and it was just be genuinely interested in what they have to say.
Yeah. Worst case scenario, you don't get the money. I mean, Channing, I love your story. You're like, and then they send you a bunch of money. That's the best ending, right? But I mean, worst case scenario, you learn things, you meet people. Learning things and meeting people is great.
And SMDM is one of the best places that I've ever been to learn things and meet people. So hopefully we'll be in Toronto next year, but we'll see. For people, this is your first meeting. SMDM is one of those conferences where you can walk up to anyone in the hallway and grab them and have a cup of coffee. And Dan and Holly are two unbelievably accomplished rock star researchers. Holly's giving me that look, but she knows it's true. And everybody at SMDM is so approachable. So you could just grab Holly in the hallway and ask her what's going on.
I would second that. Don't be shy. Yeah.
And even in this virtual format, shoot somebody an email.
Yeah.
All right.
These are my people.
Yeah.
Yeah.
So
if anyone has questions afterwards that come to your that come to your mind afterwards, feel free to send them along.
Well, thank you so much
for organizing.
Yeah,
Dan and Holly, this was so great. Thank you so much for giving us your time.
Yeah, this is great. And even as a non-trainee, I always learn so many things from this. So thank you guys.
Yes.
That's a fun conversation. Thanks for putting it together.
I don't know if you can see that.
I learned a bunch of stuff too. Thank you all.
Thank you so much. Everybody stay safe.